Good morning and a warm welcome to one and all present here. On behalf of Department of Periodontology, I am extremely privileged in introducing the Honorable Speaker for today's session, which is none other than Professor Dr. P.S.G. Prakash from Rvs Dendal Collage, Ramapuram, Chennai. Sir has pursued his BDS from Tamil Nadu Dr. MGR University between 1997 and 2002 and his MDS from Sri Ramachandra Medical University between 2003 and 2006. He did his MS in lasers from the Academy of Laser Dentistry, USA, and he also did his basic proficiency program and fellowship program in the year 2013 and his mastership program in the year 2014. He is also a fellowship and a mastership examiner since 2015. Sir is the first Indian to become the mentor of American Academy of Laser Dentistry in the year 2017. He has mentored Malaysian students on the basic proficiency laser program in Penang, Malaysia. He was also awarded the Young Best Mentor Award for the same program. Currently, he is the Asian representative of the Executive Committee of the American Academy of Laser Dentistry, and he was also the scientific chairman of the prestigious society ISPRP in the year 2020 and 2021. Currently, he is the editor of the Journal of Interdisciplinary Dentistry, which is the official journal of ISPRP. In the year 2015, Sir was also awarded the Best Researcher Award and a cash prize of Rs 50,000 from the hands of Chancellor of SRM University, and he has also won the prestigious Research Day Award from SRM University in the year 2019, 2021 and 2022. He has also won the gold medal in DPRC colloquium for PhD research program in the year 2018 and 2024. Sir has done various publications in the national and the international journals with a high impact factor, and he is also a reviewer in various prestigious journals such as Journal of Periodontology, Clinical Advances of Periodontics and Journal of Dental Research. We once again welcome you, sir, and we are extremely privileged to have you with us today in spite of your busy schedule. Without much delay, over to you to start the session, sir. Thank you.
On lasers in dentistry, under your guidance, sir. Thank you, sir. Let's start our CD program now.
Good morning to one and all. Before I could start, I have to thank few people. One is chairman of Rvs group of institutions, Samaya Iyer sir, the chief guest, Balachandran sir, my good friend, Dr. Vijay. We have known each other for years now, so as soon as he called me up, I immediately said yes, I'm on for this. And Dr. Deepshika spoke to me just a few days back, and it was so pleasing and so humble that she requested me to do this. And most of the times it's all about one-on-one interaction. When I take a lecture, I told Dr. Vijay also, like, it's good when you face the audience knows what we are talking and what we are up to, and this opportunity might be, I will take it as a beginning, because Dr. Vijay said this is just the beginning of things to come down with lasers. I think Dr. Vijay has been a part of the DCA curriculum for lasers, so he's a well-structured and a well-engineered man who could do this the best for you people as undergraduates or postgraduates. And as he said, implants might not be the cup of choice for DCA for the undergraduates as of now, but lasers are always there for you to take for the grabbing. I think my introduction is already there. Greetings from Rvs Dendal College, Ramapuram campus. This is where I work. I did my PG from Ramachandra in 2006. I joined SRM, and till date I am with SRM. So this is the front view. It's a beautiful greenery space. If by any chance you come down to Chennai, faculties and undergraduates, postgraduates, please do visit our campus. It's a beautiful campus, and our post-graduation section is getting renovated, completely air-conditioned with all touch facilities for the surgical section. So you should, if you drop down anytime to Chennai, please do have a visit. We will be happy to take you around to the institution. this is my second home. Usually most of us spend the maximum time in college. So this is where I did my fellowship and I did my mastership directly in the US under the American board. So this National University of Singapore is very, very close to me. This is where I mentor. I'm going on third for a program to mentor Singaporean students. So this is how the NUS feels like at night. If by any chance any of you planning to go to Singapore, do let me know. I can give you a visit pass because it's a separate world. Not all can enter in other than patients. So it's a beautiful place to go and be there. So this is where I work. This is the faculty of NUS Dentistry where I go and teach. These are my students. This is the place where I teach my fellowship and my mentorship as well as the basic proficiency program. Most of the times we don't, the students perform surgeries not on patients, but they do on stimulated mannequins. So you can see a TV on top over here. It has 3 red signals. The moment you go wrong, it is not like a money given degree and you got it. You have to go and perform yourself to pass your degree over here for your lasers, fellowship or your mastership. So here when you get 3 lights, when you go wrong, automatically you're done with the surgery, you're done with that exam. After 6 months you can reappear back. The registration fee which you pay stands good for 1.5 years. So you can have 3 attempts. And after that, only after 3 years you can attempt back. Okay. So this is the faculty of dentistry. I might be standing over here. You can see me over there. So this is the Young Mentorship Award and my master and my fellowship degrees which I received from the American Council. So as of now, I am the only Senate member for the Asian Council for the American Academy of Laser Dentistry, USA. So if by any chance undergraduates who want to finish and who want to register, you can talk to me, you can talk to your principal, Dr. Vijay. I can help you out in registering for this program, and it's one of the best programs which gets happening in the world, I can say, because it's directly from the American board which you will get a degree. So the contents, without taking much of it, small introduction which I wanted to give you, so that lasers are something very phenomenal. So usually everyone wants to go for implants or this. So I did my PG from 2003 to 2006. So that time implants were newly into the market and everyone wanted to rush with implants. They wanted to place implants, they wanted to restore them. I was also very fascinated. I was a mentor for the Zimmer Academy of US, and I even was a mentor for the Nobel Bank program, for the soft tissue program. But as years went by, once you start putting a lot of implants, your passion shifts a little bit. Then I thought, okay, well, what's next? The other thing which fascinated me was a bloodless kind of a surgery. So lasers was something which I was always wondering, because I have my roots with few of my friends who are surgeons who try to do a lot of hard tissue laser work with resection of tumors, soft tissue resection. So I thought, why not a periodontist with a laser? Why not we start working on laser? So the contents for today's presentation is just an overview. I know the participants are undergraduates. I will not bore you up. I have a video for you with all the surgical procedures which get in by. I will talk a little bit about history, the laser physics, how does it work, its classification, soft tissue, hard tissue pictures of lasers, which laser to buy if you are planning to buy one. Even faculties are there here. Applications in dentistry. Usually we work only as a surgical tip, because most of us think that it's advanced version of electrobotting. But actually laser can do a lot of other works when it comes to the periofield. One is it kills the bacteria by the phenomenon of antimicrobial photodynamic therapy. Other thing is it helps you to grow bone, grow soft tissue. Grow soft tissue. And not only that, it also helps you in the treatment of peri-implantitis. As I said, there were years when we used to want to place implants. But over a period of time, the placement of implants have reduced. I can't say reduced, it's increased, but the prevalence or evidence of peri-implantitis, that is equivalent to periodontitis, is started becoming more. Anyone can place implant. Any Tom, Dick and Harry you want to name it can place an implant. Because the fight is not done. But only a periodontist can treat a peri-implantitis. A person who knows about tissue and bone is the only one who can survive an implant which you have placed. So I take immense pride, maybe you can say a little bit egoistic also, but I am proud that being a periodontist, I am able to treat not only periodontal disease, which is the most in the world, and even now, most of the cases where they place implants and they have a peri-implant disease.
We have got.
What happens is, machine matters and the tip also matters.
Okay.
When you activate it and you're using it for a next case, always cut the tip,
Yes.
use it again fresh.
Yeah, that is there, sir. So the other thing is like when we're showing the cases also there's a lot of black charring which was there. So but you said that the black charring should not be there. So that's my doubt.
If you are keeping it for a long period of time, if you are keeping a hot face tip or a long period of time onto one area, then it can happen. So what happens is when you are doing aesthetic crumble thing, when the fibers are very thick, so you need to keep it there. You can't help it. But if it jars, you need to wipe it and start going with the tip which you have.
Okay.
Usually for an exam, which we work on in the NUS,
Yes, sir.
we work it on a stimulated tissue model.
Okay, it's not that
There,
patient.
you cannot leave it for a long time because it chars. If it chars, you are one wrong.
Yes, sir.
That is for the exam. So usually you should not leave it for a long time. It should keep moving.
Okay, sir. So and the other thing is, in the laser machine, there's always an inbuilt setting for each procedure. So depending on the specialty and the procedure, there's an inbuilt walls which is set up. So can you blindly follow the setting, or is it like we have to go for a lower setting and then depending on the tissue we increase?
What I would prefer is I will always start from the lower setting from what they are prepared.
Yes, sir.
And then increase my watch set.
Yeah, that
Or I can customize it.
customize it. Yeah.
Based on my kit and my machine's efficiency,
Yes,
I
sir.
usually customize it.
Yes, sir. Okay.
And seconds exposure also we can customize it.
Okay. So you would prefer always like a pulsated mode if you're going for a depigmentation. You go for a continuous mode.
All cutting works which you do, ablative work, depigmentation, phrenology, gingirectomy, everything you will use it in continuous mode.
Continuous mode. Okay.
That is the preferred. Anything which you are doing for regenerative procedures or for photodynamic therapy,
Okay.
all those will be pulsed.
Okay, sir. Okay. So the other thing is like you were speaking about the pain therapy where it's used for TMJ pain. So generally there is a specific tip for the pain management. So you could just keep it on a non-contact mode, right? And what is the amount of like the settings?
2 to 3 mm away from your intra-auricular jaw head. Or the
Extra,
classic-
you're talking extra orbit, sir, like
So,
density.
yes.
Yeah.
2 millimeters away, and then you work on a spiral mode. Usually 2 to 3 watts is what to begin with.
Okay.
The patient will feel the heat,
Okay.
and then you reduce it down to intra-bony defection. So, in a non-contact mode,
Not
2 millimeters away from the intra-bony defection.
So one
Yeah.
interesting fact which I think I got
Sure.
instead about the regenerative without using bone grafts, just with the exposure of lasers. So I think that was one thing we would surely, I think it's a very good insight we got today because generally that is, I think is it a new concept, sir? Like is it being like a new concept?
Of late, we have started using it to very rigorously.
Okay, sir. So if there is any publication related to that therapy, I think we would really be happy to go through.
I will share it to you, doctor. We have 2 publications by ourselves
Okay,
in
sir.
laser medicine
Okay, sir.
with the roller laser therapy and regeneration of intraepithelial.
Okay.
I will share it to you shortly through WhatsApp.
Yes,
Maybe you can
sir.
use it for your postgraduates.
Yes, I think that would be very insightful to us. So the other thing which I have noticed a practical difficulty when we do lasers is, you said that most of the procedures you did under local anesthetic gel. But somehow I have found that the patient's comfort is not, I'm not able to do it with a gel. So we generally give an anesthesia. So is it like really you're able to do it with a gel? That's my real doubt.
I know some of the few names in house surgeons actually, so I'll put forth the names. Everybody ask a question to the sir, okay? Some few names just known to me. Military man. You please ask questions. Give the mic so me. In military dance. So I used to always call him as an army man. So he's going to give the feedback.
Yeah.
Please. Because a lot of names are there in my mind. I asked many some of them. Many names have to.
Yeah, hello. Hi.
Hi sir.
Hi.
Because in any questions came, you ask some questions, how it is, how it was, so that they give feedback. All are feedback. So other than I'm struggling to break it out from my students. But even though they have the knowledge of theoretical part, they will be coming to the Chennai. I used to always advise them. Yeah. Somebody was instructed.
Something understood?
Laser
All of
full
you?
form. What is the full form of laser?
So was I pass?
Line amplified by simulation. Evidently.
Give me a definition. Good.
Yeah, very good. Yes, I really am.
Prithvi Raja.
He is Prithviraj famous writer. Oh.
Dr. Izaz.
He's
Okay.
yeah. He's a start.
Izaz, புரிஞ்சுதா அது?
சரி சார்
தூங்கி நல்லா
இல்லை சார் நல்லா இருக்குது
Okay.
And the next
Very
is what is the name?
Laser வாங்கிருக்கியா?
Hygiene certificate.
முடிச்ச உடனே laser வாங்கிடணும்.
சார் கண்டிப்பாக வாங்கிடுங்க
Next is what is his name?
Super. வாங்கிடு.
So this is Dr. Sangeeta.
ஆக்சுவலி உங்களுக்கு இந்த பெரிய பிஜி பண்ணோன்னு எப்படி இன்ட்ரெஸ்ட் வந்து
எனக்கா ஓகே தட்ஸ் a good question. பிடிஎஸ் முடிச்சதுக்கப்புறம் ஐ யூஸ் டு அசிஸ்ட் டாக்டர் அருணாச்சலம் அப்படின்னு சொல்லிட்டு ஒரு டாக்டர் இருந்தார். யூஸ் டு பி அ வெரி ஃபேமஸ் பர்சன் இன் சென்னை ஃபார் இம்ப்ளான்ஸ் அண்ட் பெரிய மேனேஜ்மெண்ட். பட் எனக்கு யூஜியில் வந்து தாயுமானவர் அப்படின்னு சொல்லிட்டு ஒருத்தர் இருக்கிறார். தாயுமானவன் அவர் பேர் ரொம்ப அழகாக தமிழ் பேசுவார் அண்ட் பெரியவும் செம்மையாக சொல்லி கொடுப்பாரு. I started fascinating towards Perio because of the regeneration concept. ஒரு 7 அளவு கஷ்டம்ன்றது நம்மளுக்கு மட்டும் தான் தெரியும். நம்பர் 1. Number 2 is I taught my entrance exam in Ramchandra. They gave me, asked me any seat you want to take. எல்லா நாட்டில் ஆர்த்தோ ஓரல் சர்ஜரி இதுக்கு தான் அடிச்சுக்கிட்டாங்க. நான் மட்டும்தான் பெரிய எடுத்தேன். This is the first time. I didn't bother for anything else. But I am still not regretting because I learned as much as possible with them. I think Dr. Vijay knows. I own a luxury car, I own a good, whatever I have done is because of what I have learned from. A simple regeneration case fill your pocket like anything. If you are doing it right. And
பண்ணலாமா?
2024 ஒரு கேஸுக்கு 15,000 ரூபாய் வச்சனா கூட ஒரு வருஷத்துல லேசர் மிஷினுடைய வாங்கின காசு அடைச்சது 8 வருஷமா நான் அதை வச்சு சம்பாதிச்சுட்டு தான் இருக்கேன். So you can study about which gives you money. Here is one thing where all other fields revolve on. பெரியோ இல்லை அப்படின்னா பல்லு இல்லை உனக்கு பல்லு இல்லைன்னா அதுக்கப்புறம் நீ ஒரு யூஸும் கிடையாது. So whether you want to give a bridge, whether you want to give a strong tooth, whether you want to keep the tongue, it's a healthy everything Paragandas. And I am a proud Paragandas. Sometimes very egoistic also.
So thank you so much for
Yes, Nora.
your insights on laser and applications of laser, especially in periodontology. So could you just tell us about the course that you have done in laser in America that you have done? Could you just give us some insights on that?
I did my first for this Academy of Laser Dentistry USA, and basic proficiency exam consists of physics, and you register $180 or $220. When I 15, for $350. So when you register that, you are eligible to write that exam price. There are 30 MCQs which you will get online, and everything is on physics of lasers. So என்ன பண்ணுவீங்க அப்படின்னா கம்ப்யூட்டர் முன்னாடி உட்காருவீங்க, அங்க இருந்து கொஸ்டின் அனுப்புவாங்க, 6 seconds for a question, and you can get நீ 12 மார்க் எடுத்தா பாஸ், but every wrong question has a minus mark. So what happened this time when I wrote, I got minus 12. So second time when I wrote, I passed, luckily, clearly. And after that, I wrote my fellowship. That's a 1-year program where you do a thesis kind of thing and go and present in front of 16 examiners. Either you can do it in NUS or in Dubai or in Malaysia, Penang. There are centers which they have. You can register anywhere. Or you can go to US directly also and register. So once you finish your fellowship, they give you a fellowship degree and you have a 1-year break. After that, 2 years you need to do your mastership degree. Either you can extend your fellowship thesis or you can extend your mastership or do a new thesis for your mastership. So once you do that, then you go and present it, and that's how you get your mastership. So do that.
Session-wise paper presentation and back the overall paper in epidemiologic research. Now I call upon Dr. Sandra Kumar sir to felicitate the doctorship.
Which was conducted in Dr. Rvs Dendal Collage, where many of our undergraduates took part and they have won the overall prizes. In that, we'll start on with the third place was backed by Ramya and Neetika. I call upon Dr. Deepshika ma'am to felicitate the toppers. The second prize was backed by Ebenezer and Sangeet. I call upon Dr. Shakti Ganesh sir to felicitate the toppers. It was also shared by Nitishri and Narmada. first prize was bagged by Saunya, and we call upon Dr. Sendal Kumar sir to give away the prize. And the consolation prizes were won by Nitya Prabhakar Puram, Sauvarnika Nemopriya, now we call upon Kanimuli ma'am to felicitate the toppers. Ritu Dashmi and Pooja Shri. Now I call upon Dr. Bindu sir to give away the certificates to the participants.
Participants are Mukashina and Manavika.
All the participants did a great job. So even if you didn't win, we totally appreciate. We had a lot of 26 participants. So I think you should give a round of nice applause for all of them.
Mukashina and Manavika. Shubhaprabha and Tilmale Vasan. Deepti Ashmita.
Round of applause, students.
Preeti Sangeetana. Shweta and Krishnapriya.
And we are very happy that they have bagged the third place for the overall highest number of participants in the poster presentation. Now we call upon all the participants and the winners to receive their trophy.
So it was a national conference, and I think among all the national colleges, RVS got the third place. So it's a real achievement, and it's an encouragement for all of you to take part. Okay? So we want people who are not present to take part. So I think a big round of applause.
Prize in Moksha Dental Gallery.
So this was another, I think already we have done the same thing. They have designed the pro. So this time we got a special mention. Soon we are planning to integrate it with AI. So I appreciate the effort. They were just in third year when they started the project. So it doesn't matter whether you're third year or final year. It is only that you have to have this spark of creativity in you. So we want many more like this in the final year's interns. Okay. So all the best. And we want to pay for this.
On behalf of World Hygiene Day, several contests were contested last week. In that, the debate.
Debate contest was conducted on topic Artificial Intelligence, a boon or bane, and the best speaker on the debate contest goes to Tarun Raj, second year.
A special mention on Tarun Raj. I think I wanted all of you to see the debate, but he spoke so well, being the youngest in the whole batch. He outtook our PGs also. So we wish him many more like this. Round of applause, students.
Backed by Blue Team, the members are Jai Shakti, Harita, Dr. Shivasaran, Shruti, Noora, and Deepti.
Round of applause, students.
It is here, Pratiksha, Ratna Gokul, and Tarun Raj.
So they got the runners for the debate. They spoke very well, each one of them. I think they were junior and compared to the other team. The other team was PGs and interns, but they all spoke very well. Final years, interns, okay? So we got very good
And for wealth out of waste, they did wonderful innovative models. In that, the third prize was backed by Deshika Priya and Soumya, which was also shared by Pavitra and Animal.
round of applause. They did a very good model. They exhibited the models in the auditorium, so all of you can have a look so that you could also get some ideas next time.
The second Adani and Dr. Nirosh.
Round of applause to go to the highest place in competition.
Second prize was bagged by Soumya.
Round of applause to them.
And the first prize was bagged by Shweta Tari.
So we appreciate the effort of the third year because she was the first to send the entry for the essay competition. So being the third year, she took the effort. So very well done.
Our dearest and enthusiastic third year postgraduates of our department have worked on and off of the academics and extracurricular and all the activities. They have made in and out to make out the program wonderful. So we have, our head of the department and all the staffs have planned them to congratulate with the more vibrant awards.
So we have a big surprise today for our exam going PGs. So we thought that they have been very, very sincere during their post-graduation. I know it's been very difficult because so many multitasking. So we are going to acknowledge the effort of our PGs with awards depending on what each person has their ability, not just in academics, in many other aspects. So we have tried to appreciate each of that among our postgraduates. We bless them and we wish them all the best. Okay, so the first award is the
First award is a AAA award. Academic category was backed by Dr. Soumya.
The award is for academics, attitude, as well as attendance. So I think Soumya is very, very, very sincere. We have the next award.
The next award is the Rvs and Pinnacle Performance Award. Can you guess? Can you guess the
Salute and pinnacle performer. So basically it's about how they have evolved themselves, like they have put in a lot of hard work, and from what they were, they have reached a very, very high level and they have achieved many things. So I think
This goes to Dr. Bhavani.
so actually to mention about Bhavani, she's been a very, very hard-working student, and I think from what she was, I can expect that she has evolved so much as a speaker. She's done so many research products, and so I think we wish all her many more projects and all the best. So the pinnacle performer on to Dr. Sivasaran and wish him all the best.
As junior PGs, we are really very privileged to tell about them. They're not only a postgraduate, they're really very friendly, and initially we doesn't know when you come to the department how to get adopted with the works. They really help on and out of everything. A great thanks to them, and really we'll be missing them here.
So I appreciate all the postgraduates because they've been working, and even the internal batch who were posted with us, they have been working day and night in a very short time. So round of applause for all the people who worked for this.
Join us for the photograph.
Everyone, I am honored to stand before you to express our deepest gratitude for your presence and support today. First and foremost, I extend our heartfelt thanks to our distinguished speaker, Dr. P.S.G. Prakash, Professor, Rvs Dendal Collage, Ramapuram, for his enlightening presentation. Your insights and inspiring words have truly enriched our event. A special thanks to our Director, Principal, Dr. P.K. Vijay sir, for constant motivation and remarkable presence at all times. Your unwavering commitment and ensured everything ran smoothly and successfully. I want to extend my generous thanks to the management and AO sir for his support and cooperation. On behalf of Department of Periodontology, I would like to thank all the department HODs, other staff members for their solid support. Last but not least, I would like to thank final years, interns, PG students. Your tireless work behind the scene has not gone unnoticed. We are grateful for your support. Finally, let us all thank a moment to express our heartfelt thanks to God, for without His guidance and blessings, none of this would have been possible. Thank you all. Once again, have a wonderful day ahead.